What's up, you guys? It is what day? Lipo C day, and our old girl MJ15. So let's get into it. So I've been on my MJ journey. This month will be October will be 2 years. Your girl is 145 pounds. Started off at 205. And my highest weight was 205. And Lipo C and MJ has changed the game. Okay, so I'm an ambassador with the Body Clinic. I take Lipo C. This is the 1 ml dose. Most of you guys who follow me know. So anybody who's new, I'm Erica, and I've been on GLP1 going on 2 years. I was part of what's considered some of the OG gang, and so I've been through lots of things through this process, but I'm super grateful. I've been in maintenance since November 23. My maintenance weight was 150, and I'm currently 145. Pretty much trying to make sure I don't go any lower than 145. And so Lipo C, this is to be taken at least every other day. And it's not to be refrigerated. There's no side effects that I know of. I've talked to one person who said they've had some side effects. Most people don't have any side effects. If you're new to Lipo, you should definitely start off with the 0.3 or the 0.5 dose. It's not the best to jump right into a 1 ml dose, but this is the max dose. You take it every other day. And it's fat, so you have to pinch the skin, and you'll put it in the fatty area of your skin. Clean it with alcohol and take the injection, which I'm about to do now, and then you just do that every other day. And Lipo C is super awesome with helping, it targets fat, and so it helps you along your weight loss journey. I was in a stall back in May, which is what put me onto the Body Clinic when I started Lipo C. And my girlfriend Sharon introduced me and told me about Lipo C and the benefits, and that's what started me on this Lipo journey. I became an ambassador a few months later. I'm still an ambassador. I'll add the code on the screen for 15% off all products. They also have Lipo B, which is good for energy if you need it, and they have all kind of weight loss products that should help you on your journey. They have journals. They have shapewear. They have waist trainers. All the things like. Trust me, you want to check out thebodyclinic.com if you would like to have some help with your journey, wherever that is, okay? So let's get into it. So I want to drag this out. So let's do the 1 ml dose of Lipo C. And I plan to stay on Lipo C. I plan to stay on GLP1. And because there's no way. If you know, you know, okay? If you know, you know. I dropped the whole alcohol pad, y'all. Dropped the whole alcohol. And so in the bag, in the supply of injections, you get a 30-day supply, and with that discount, start off at 0.3. Hopefully, you could probably get it to the door less than $100 for a 30-day supply. They come already pre-filled, and you'll get about 16 syringes. And you get the alcohol pads. They come with alcohol pads and instruction card that tells you how to take it. Okay, so pretty much clean the site. Take the injection, pinch it into the fatty tissue right there, and then you wipe it again to clean it off when you're done. And alcohol, that's make sure it's cleaned off again. And that's pretty much what we do. 1, 2, 3. And so because I take 1 ml dose, I kind of, if I like to push it too fast, but you just want to push it in that fatty tissue, okay? It takes me a few minutes just because there's so much. But anyway, Lipo C is also for that. Lipo B for energy. It does help with weight loss. It has some weight loss products in it as well. So they also offer GLP1 compound version. If you're interested in, in compound, if you can't get actual GLP1, I guess. I get lots of questions about my journey. So if you ever have any questions about it and wondering if it's something that you would like to, consider, or if you're having some issues with stalls, talk to me about that. But Lipo C has definitely helped me with stalls, okay? I definitely feel like the GLP-1 helped the most with the weight loss, and the Lipo helped with the toning me up, right? Snatching this body up. So help get that waist snatched in and all the things. So yeah, you can definitely ask me any questions. I get lots of questions sometimes about what to do about stalls, and most people think I had one lady reach out to me the other day, and she was like, should she go up in dose on her GLP1. And I told her, everybody think that going up is in a hurry to go up. Don't be in a hurry to go up all the time. Because sometimes if you were having success on the lower dose, sometimes it's not a bad idea to go down in dose if you were having success. So we learned through our journey that you shouldn't be moving so quickly. Because 15 is the max, and when you get there, there's nowhere to go, right? So just take it easy. Don't rush. If you're starting off on your journey and you're on 2.5, stay on 2.5 until you're not losing weight, okay? Don't be such a quick rush, because we didn't know better. We was just changing doses every 4 weeks, and not understanding that that wasn't the best way to do it. So we try to make sure we let you guys know, people that's new to this journey. So many new people, on this journey, and so much success like this has changed. I could not lose weight to save my life, you guys. Like, people sit back and look and judge and try to, oh, you're just taking a shot to say what you want to say. I tried everything under the sun to lose weight, and I was not successful till I found this medication and Lipo together. I'm almost done, y'all. I know it's taking a little bit of time. But Lipo C, to me, it's like Lipo suction, almost like it helps to snatch you right on in. And some people like to do the B and the C. You can do that. They have a combination called MIC. It's the Lipo B and C MIC. So that way, if you need energy, I don't need energy. I'm pretty high strung. All right, there we go on that. I'm going to get the lid. And then we're going to do the Mounjaro. Okay. Oh, I need this alcohol, y'all. Let me grab another one. Just dropping it away. Dropping it. And when you get the alcohol, always try to let it air 30 seconds, before you give your injection, let it dry for 30 seconds. Okay? All right. I think that's good to go. And so now, I'm going to put this one in the back of my arm. Oh, if you don't know, you need to be rotating your sights. Don't put it in the same spot every time. Some people like to use just their belly, but the best absorption going to come from you rotating the sights. So just rotate the sights. Each arm, your belly, and your thighs, okay? Just rotate the sights. It's going to be more effective. If you've never seen a Mounjaro pen, I know a lot of people don't using compound. Most people, if you haven't seen it, I know even this and the Zepbound. Zepbound is the actual same medication, but it's the weight loss version of this, okay? Mounjaro, Zepbound, same med, different authorization. So the FDA approved it for, this is approved for diabetes. And then Zepbound is the weight loss version. Okay, you have to meet certain criteria. I have a prior authorization approved. That is how I get it. I am with Enbold. I've been with Enbold for almost going on 2 years, and they take care of all my prior authorizations. So this is how I continue to be on the name brand Mounjaro, which is tirzepatide. And so Zepbound is also tirzepatide, but it's for weight loss, and you have to meet certain criteria. You have to have a certain BMI and those things. But just understand that if you can't get it this way, if you don't meet the requirements to get this, if you don't have an authorization or you're not type 2 diabetic, then you can possibly get this same medicine on a weight loss version, okay? Just understand that you got to meet certain BMI requirements, okay? So let's do it. So anyway, their pen looks just like this one for the most part, and you'll see the lock here, so we pretty much would unlock that. And I am still on 15. I've been on 15. People are like, why are you still on 15 and you're in maintenance? It just works for me. It keeps my food appetite good. It keeps me maintaining well. I haven't had any issues, so I continue to do what works for me. Some people go down to 5 and go up. I'm good on 15. It has been doing what it needs to do for me, okay? So, my little thing. All right, we're going in the back of my arm. And listen, I don't care how long you've been doing this, you always never really prepare for that injection because you just don't know if it's going to hurt or not. I do say that one thing we did learn is to take it out of the refrigerator a little early because the cold one does burn. So this has been sitting out. That don't mean it ain't going to hurt, okay? So you're never prepared for this injection, okay? You just don't know what you're going to get, and we're going to do it together. 1, 2, 3, here we go. Yeah. It stung a little bit. It wasn't too bad. 1, 2, 3, 4, 5. Okay, and so usually you can see that the liquid is gone out of that chamber there, and so you can see that little bit of sting right there, and that is my injection, you guys. That is it. If you have any questions, let me know. Hopefully this has been helpful. Again, I did mention about just talking with your physician to see what's best for you as far as if you're in a stall. Lipo C does help with that, but you also want to make sure you're communicating with your physician. You want to make sure that you are eating your protein, that you're not missing meals, because people think you still need to starve yourself and be intermittent fasting and all the things. You really need to eat, and eat protein, okay? And making sure you're drinking your water, and of course, moving, okay? Let me alcohol this because I feel this. Yeah, see that? Oh, listen, we never get rid of it. And you never get used to that injection, okay? So anyway, if you have any questions, just listen below. Get them, Erica. I'm your girl. I don't mind answering any questions, and I'll talk to y'all later. Happy Sunday.